Hey, good afternoon, everybody. I want to thank you for joining me for this week's Facebook Live update. This is your County Executive Ed Day, which I hope you know by now if we've been spending so much time together. Before we get into your questions, I want to update you on some of the enforcement that has been going on here in Rockland County. There's currently a two-pronged approach. First off, we have contributed 15 personnel, county employees from the Department of Health, the Office of Fire and Emergency Services, from our consumer protection and others on an ad hoc basis to be part of the New York State Police Enforcement Task Force. This is that cluster action initiative that the governor announced a couple of weeks ago. These county employees are joining with state personnel and state police to patrol areas within the red and the yellow cluster zones. Now, to be very clear, the state has commanded this effort, and we are in a support mode with this. We simply supply people to accompany them, and they go to the places they've identified. These are not things that we drive the train on. I just want to be very clear about that. We have asked the state task force to provide us with all of the data on their actions over the past couple of weeks, as we only have support members who do not have a full grasp of the totality of what the enforcement taking place. Until we get that information, obviously we can't share with you, but when it becomes available to us, we'll make it a point of getting that information out to you. The second prong of the approach, which obviously we can share because it's county driven, goes back to an a commissioner's health order that was issued. As most of you do know, we have had very little latitude given to us from the state. The last emergency order the governor put out did give us a bit of a crack that we can engage in, and our health commission has seen that, went and put together a health commissioner's order that essentially has us focusing on children in our community, our kids who are on buses, our kids who go to the schools, but mostly on our buses. There's a reason for that. The emergency orders that the governor put out some time back, as you remember, they're enforceable by local police only. That's because they can be a criminal violation of the law, and in order for anybody to enforce that, they have to have that authority under the New York State penal law. The problem we had with that issue when it relates to children in particular is that the way the order is written, the summons would be given to the person who's not complying with the face mask order, which means if you're dealing with an 8-year-old, that's who would get a ticket. Now, of course, that is absolutely asinine. It was never going to happen. So what the commissioner did was change the focus as it relates to our children who are being transported back and forth from school to home, and essentially have placed the responsibility and the accountability for any actions on, number one, the school bus company, and number two, the school district, especially obviously the school district is running that particular bus service. That is what we're doing right now. And again, it makes a lot more sense doing it that way for obvious reasons. The other concern that the health officials do have here, and I'm sure you've heard this, is obviously children are the ones that are least inclined to get this virus. However, they have tested positive. The concern is that these little ones could be serving as super spreaders. The kids will have the virus, will show no symptoms whatsoever, go home, and potentially infect other people in their own family unit, and particularly the older folks who were in that family unit. So that's the reason why Dr. Rupert put this together, and I will report to you some of the information we can report back to you as far as enforcement. As of today, the Rockland County Department of Health has received 78 complaints about 50 separate locations. Obviously, we've gotten more than one complaint in, which would show for the variance. The inspectors have completed 24 inspections to date. On 21 of these inspections, no violations were found. The 3 violations that have been issued were issued to the following entities: United Talmudical Academy on 89 South Main Street in Muncie. An inspector there observed at least 60 children exiting a school bus and exiting and boarding school buses. Estimated that about 20 of them were wearing face coverings, the remainder were not. They also observed 6 adults come out. 2 of them were wearing face coverings and 4 were not. The other observation that was made was over at the Alkheim Learning Center at 18-24 Shea Road in Muncie. Inspectors observed approximately 25 males standing in from the learning center. None were wearing masks or face coverings, and observed additional persons entering and exiting tents located in the rear of the property. None of them were wearing any kind of face coverings. Congregation Vienne of Muncie, Benos Vienne, 70 Highview Road in Muncie. Inspectors observed approximately 20 girls, approximately 9 to 10 years of age, sitting at desks in a classroom. None of them were wearing any face coverings, and estimated that the desks were approximately 3 feet apart, and observed a second group of approximately 8 to 10 girls, approximately 6 to 7 years of age, standing at the windows looking out. None were wearing masks or face coverings, and they were standing about 1 to 2 feet apart. I want to be very clear about something. We're not looking to play a game of gotcha here. We are very simply looking to enforce the law, especially when we see basically gross deviations from what should be accepted. We're not going to be taking action if we see 2 or 3 kids without a face covering out of 50. That's not what we're looking to do. I've been very clear to my people with the Department of Health, and that when they go out, they see things that are just a blatant disregard for what they should be doing, that certainly is eligible. And there are a number of investigations that are ongoing, and there is a procedure to this. I think people should hear this so you have a better sense of understanding exactly how the commissioner's orders are handled, because they do have some significant fines attached to them at the end of the line. First of all, the complaint is received. That's how it begins. Our Rockland Codes Initiative inspections team will visit and gather evidence. These are the same members who went out and really did a great job on the slumlord housing, as you recollect. They're experienced in this. If they see the evidence warrants it, they will issue a notice of charges. The respondent of those charges has 5 business days to respond back or to object in writing. After receipt and review of objection, or if there's no objection, the Commission issues an emergency declaration and an enclosure letter. And if the respondent can present new evidence to claim a mistake of law or mistake of fact, that request for reconsideration can be filed. So that's how that works there. And again, most importantly, if you are aware of any violations of this area where it comes to our school buses, we'll certainly please call our county health department hotline at 845-238-1956. It's 845-238-1956. That's Monday through Friday, 8 a.m. to 5 p.m. There will be a follow-up investigation based upon the information that you share. So again, be as detailed as you can be. That's always very helpful. I'm a former, obviously, investigator myself with the NYPD. That information makes life a lot easier. It also allows us to get out quicker, to identify the issues faster, and to get back on the road and deal with the next issue immediately. You can also send an email to the COVID call center at co.rockland.ny.us. That's the COVID call center, one word, at co.rockland.ny.us. And also, this will be placed at the comment section at the end of this broadcast. So if you haven't gotten a pen yet, don't worry about it. You'll be seeing that on our government Facebook page. I do appreciate the Facebook communication that I do get. It gives me a sense of what's going on out there. But please understand something. The slowest way that you can get information to the investigators is to put it on Facebook, either post it or send it to me, because we're not monitoring that. I obviously have a lot of things I'm doing. I typically will look at my Facebook page a couple times a day just to respond to questions that people may have or clarify points. And then I am working my major responsibilities, which is running 25 different departments in county government and 1,700 employees to boot. So I have a relatively full day. Right now, we're going to turn this over to my communications director, John Lyon. He has been fielding some of the questions, and he is well known as the proverbial man behind the curtain. So, John, let's have at it.
Thank you. The first question I want to address is something we didn't touch on last week. What's with the sling? What's going on? How are you feeling?
Okay. What's with? You got some questions about that. What's with the sling? Okay. Well, let's get to dispense. I've had surgeries in this arm twice. 95 when I was at the NYPD during a line of duty injury. 2003, I took a tumble and fell, put my hand straight out, and injured it again, and I had to get surgery again. I've had a couple of incidents, one a couple of years ago, where I did tear a tendon in my arm to some extent. I had another incident just a few months back where I did have another tear in my shoulder. So you can just tell by all of that that the shoulder was somewhat of a mess, and the therapy was not working. So I decided to get the surgery done. The surgery was involved. It was about 3 hours long. They had to put 3 anchors in my shoulder to kind of, I guess, rerun the wiring, so to say. I want to give a shout out to Dr. Badra, who from Northeast Orthopedics, who is my surgeon. He gave me my new hip also. Tremendous surgeon, great guy to boot. I want to thank him for his work. And my goal here right now is I have to keep this on for 3 weeks altogether. I'm doing passive physical therapy. I'll be doing active physical therapy come the end of the month. But until then, it's critically important I keep my shoulder stabilized, because any sudden movements could end up loosening the anchors on my shoulder. So we don't want to see that happen. My goal right now is I have a streak of throwing strikes at Boulder Stadium on opening day when I'm asked. I'm looking forward to be doing that again. So I'm going to do my work in physical therapy, get myself all ready. But you should, I'll be back to wearing a tie soon, probably about a week or so. But I'll be out of this thing very soon. And for those who I know previously had sent best wishes to me, well wishes to me, I want to thank them for that. And I'll be out in the mound hopefully come May or June, whatever the opening day is.
Okay, glad you're on the improve there, and thank you for addressing that. Thank you as well to everyone who wrote in today. Our first question, what is being done to address the recent media report that residents of the red zone may actively be trying to lower the COVID positive numbers by refusing testing if they're sick and only sending healthy people to be tested?
Okay, we've checked with our Department of Health. They've actually asked, because there's been rumors of this in Orange County also. Right now, we're looking at them as rumors. We have not been contacted by any of the medical providers about symptomatic individuals refusing tests here in Rockland County. We have a very good relationship, our Department of Health and the larger medical community. We have not heard that at all directly. So we can't confirm it there. To be clear, it does not seem to be a legitimate issue here, but we are still seeing a very high level of testing across the county, across the state, across the region. So there is a lot of testing going on, but we are keeping our ears to the ground. We obviously, anything that's going to skew the numbers in any direction, we certainly don't want to tolerate that. So we are keeping our ears to the ground. If any of you hear anything, obviously let the health department know. We would take that information in, but it has to be something of substance, obviously, not a Facebook rumor. That we do here, anyway. Don't need more of that. But interestingly enough, I'll share another thought with you. In some quarters of our county, they're only testing being done by on symptomatic people. There are people who are not getting tested who are asymptomatic. So that could be skewing the numbers the other way, because if we have a pool of people taking the test and a significant number of them are symptomatic and they test positive, those numbers will drive our numbers higher if we're not taking a larger group of people that include people who are not positive, which obviously would lower the percentage of infection rate down. So it's a sticky situation, but to the concern that's been raised, we will keep our ear to the ground on that and make sure that if we hear anything like that, we will act upon it.
Great. The next question, there have been reports in the media, reports on social media, that private schools may still be operating in the red zones.
Right.
Is this allowed? What can be done about
Okay,
this?
well, if you're in a red zone, whether you're a public or a private school, you need to be closed. If you're in a yellow zone, you're going through enhanced testing. I think 20% of your population each week has to be tested. And if you are in a red zone, again, you get in-person. In-person instruction is out. They can do instruction by the internet. That's another story. But if you're aware of a school that this is happening, please report it to the governor's hotline so that the information can get to the New York State Police Enforcement Task Force. That number is 833-789-0470. Did I get that right, John? 833-789-0470. That's the state hotline. Again, it's the quickest way to get that addressed. We're looking at school buses. Obviously, we have seen some of the schools too, and working on that. But our prime focus are on the buses. Again, these are civilian inspectors, the police, the state police, and the state task force are really focused on the larger issues. You've heard about some of the issues in Orange County. These are massive scenarios. So, again, it makes a lot more sense to have law enforcement personnel responding in situations where there's a crowd for obvious reasons. The other thing I will address was speaking about is that I've gotten a lot of comments about school buses on the roads in red zones. The mere presence of a school bus on the road in a red zone does not mean something is going wrong or they're doing somebody's doing something wrong. Buses are allowed to travel through red zones. The issue is where the school is located. The school is located in a red zone, and that bus or any bus is going there, bringing children and picking them up. That is illegal. That is against the rules that the governor has put out, and that is where we, again, get a hold of the New York State Task Force, because they are responsible for enforcing the governor's zone restrictions.
Okay. This story has gotten a little bit of coverage recently in the media that there is a lack of laptops and tablets in the East Ramapo Central School District. It's resulted in what's considered chronic absenteeism because these students can't get on the internet, can't get to class. The question is, can and will the county intervene to find a way to provide the technological resources required for these students to attend school?
It's a very good question, and it's a damn shame. It really is. As a practical matter, there is pretty much of a firewall on most issues when it comes to the school district, who answers to its own hierarchy. The schools answer to the school district. The school district answers to the state education department. They do not answer to the towns or the counties or the villages. That's just a fact of life. There are exceptions. We work with the school districts, for example, with mass purchasing through our purchasing department here at county government in order to soften the blow, as it were, when it comes to cost, get better prices for the school districts and their purchasing. I will tell you, it relates to this specific issue. I had a meeting today with Dr. Ray Giamartino, who is a new school superintendent in East Ramapo School District. It was a very good conversation with him. I found out we had something in common. We're both from law enforcement families. His dad was a police officer upstate. That's where he is from. We spoke about the Chromebooks because, again, we've been hearing the same thing. The Chromebooks, he has an auditing background. He found out very quickly that the things that had to be done to get those books into those kids' hands did not happen as fast as it was supposed to be happening. He has lit the proverbial fire under whoever he had to already. He is very focused on this, and he's looking at getting these Chromebooks in as soon as possible. I will offer also that there is some efforts being taken up by other just citizens in the county to try to get Chromebooks into these kids' hands. You may remember that the McCourtney twins, the New England Patriots, who are both Valley Cottage Indian graduates, because I coached against them. That was not a pleasant experience because those two young men were extremely talented. Made things very difficult for the New City Rams when they were on the field. They donated, I think, about 90 Chromebooks, I think, last year. Clarkstown Rotary is engaged right now in an effort to raise money for these children to get Chromebooks. Right now, they have a $10,000 goal. They've raised almost $2,000 already, so they're 20% there. It's called Computers Give the Opportunity to Education. It's a GoFundMe page. So it is on Facebook right now because I was asked to share on my page, which I did do. I sent it off to a number of people who are administrators and very large Facebook pages. So it probably has a reach of about 75,000 without any additional sharing. So if you can go to GoFundMe, look up Computers to Give Opportunity of Education. If you can help it, that would be great. There already was some computers already brought over to the school, so it's an ongoing effort right now to try to lighten the load and to help these young people out a bit. Because again, they are caught behind the 8 ball right now, and it frankly is just not right. It really isn't.
Okay. And the last question that came in today, I think, was tinged with a little bit of sarcasm.
Just what I need.
But did you read the governor's new book, or are you waiting for part 2 to come out?
I have not read the governor's book, and governors don't take it personal. I also remember all too vividly the last 8 months, and we have dealt with over the past 8 months now. and I really have no desire to relive it either through your eyes or my own at this point. We're just trying to get through it right now. That's exactly what I want to get done. Let's get this thing fixed and done and move on with our lives. There are a couple other things that I want to do catch up with. One, tomorrow, our Rockland County Department of Health is going to be having an outdoor drive-by flu clinic up at building, is it building A?
It's actually outside of Building F.
Building F, okay. Building F on Sanatorium Road, right off Route 45. Just follow the signs of Building F. There is a drive-through flu clinic between 10 a.m. and 2 p.m. Go check on our health department, on our webpage for health department for details. There was just a press release put out. So go to rocklandcounty.gov and you'll navigate there and get some details on that. You basically bring ID if you're a senior, because I believe we may have the shots may be free for seniors. So bring some ID showing that you're an old guy like me, and you'll be able to get that shot for free. But that's number one. Number two.
If I can interject
Oh yes,
real
please,
quick,
by all means.
it's also a walk-up clinic. So if you're taking public transportation, if you're in just in the neighborhood, you don't have to drive. You can walk up, and they will be able to get you your flu shot as well.
This is why I pay John the big bucks, or you pay John the big bucks. Anyway, early voting. Again, every election's important, and I know I'm a bug about this. There's no question about it. I'm a very strong, fervent believer in the fact that we have had men and women in the military in particular who have given up their lives to give us our freedoms. Our most precious freedom is the right to be part of this your own government, a participatory democracy, or a republic, actually. Voting is an integral part of that. It is frustrating when I see a turnout of 35% on local elections and 65% on national elections, especially local elections. Those elections are the elections that chart your future out as it relates to a variety of different issues. So, please get out and vote. Early voting is convenient, I will tell you that. Early voting is being held starting Saturday. Saturday, John?
Yes.
Saturday. At the 4 of the 5 town halls. Unfortunately, they could not get coverage up in Stony Point, so there'll be a North Rockland voting area. It'll be at Haverstraw Town Hall on Rosman Road. Orangetown Town Hall and West Orangeburg Road at Dutch Hill Road. Ramapo Town Hall in Suffern on Route 59, just east of Airmont Road, and Clarkstown Town Hall at 10 Maple Avenue here in the center of New City. So October 24th it starts. You can call the following number to get further details. There are 1, 2, 3, 4, 5, 6, 7, 8, 9. It looks like 9 different days that you can go starting Saturday, which is 9 a.m. to 2 p.m. But you can just go online to rocklandcounty.gov, go to the Board of Elections. Did I mess it up?
Yes.
rocklandgov.com.
That's the one.
You think I get this right by now. rocklandgov.com. Thank you, John. And go to the Board of Elections, and you can get the details there. Or you can call 638-5172, 638-5172. As we close... I forgot something else.
No, you didn't forget it.
Okay.
I should have mentioned it before. The hours every day for early voting change. Sometimes they're in the morning, sometimes they last into the evening to give you a chance depending on what your work schedule allows for. We want to make it as easy as possible for people to have that opportunity to get out and vote.
Okay. Thank you, John. Appreciate that. Look, as we close things out today, I just want to say this. No matter how you feel about the current restrictions and the governor's orders, there are a lot of opinions out there, and I have my own also. But we must follow the rules here. This can be a deadly disease. That's despite the fact that hospitalizations are relatively low and completely manageable. But we have reported 3 deaths this week from COVID-19. That brings us to a total of 5 residents who have passed away in this month. Now, I'm not offering this to you to frighten you or to panic you or to scare you. I'm offering it to emphasize the seriousness of what we're dealing with. You may have nothing to worry about when it comes to COVID-19. You may be healthy, you may not be susceptible to this particular virus. Nobody knows how yet. Nobody understands it. They just know that some of the basics are the things that we need to do, and that is basic positive hygienic habits. Keeping your, it used to be keeping your face out of people's faces. Now we're going to have a face covering. That's number one. Number two, washing your hands. Don't touch things and touch your eyes in particular. Keep your hands off your face where you can. Socially distance, obviously. If you can't stay 6 feet away from someone, make sure you have a face mask covered. Just common sense precautions to stop the further spread of this virus. And look, we look at taking this action not so much for ourselves, but you should. But let's think of it this way: if you are feeling bulletproof and you don't believe that this will ever get you, despite the fact that people of all ages and backgrounds have been hit with this disease. My own son Mike, I mean, he's Army Special Forces. They don't make him any tougher than Army Special Forces. With all due respect to the Navy SEALs, this is an Army family. But he got hit with it, and it was not fun. I mean, he took a good shot. He did get up. He's fine now. My daughter-in-law, Leanna, excellent physical shape, very young. She's in her early 20s. She took a pretty good hit too. My nephew's got this disease also. So, you know, look, if not for you, make sure it's for others. Make sure it's for your friends. Make sure it's for your family. Make sure it's for your neighbors. I think the key here is keep others in mind. That should be your golden rule as it comes to this. We, again, do not have a immunization yet. We do not have, we'll hopefully have it soon. We do not have a natural immunity that we're aware of. We have to live with this virus, and I've said this pretty much every time I've spoken to all of you. And that's okay. We can live with it. We just got to be smart about it. It's not going anywhere. We need to have our lives, move along, do what we have to do. But again, be respectful of this virus. Be smart about it. Take your own precautions. If you are not comfortable going someplace, that's fine. That's your decision. You have your own free will here in that regard. But again, the most important thing, as I said, keep others in mind, because together we will get through this. We have had many challenges in this nearly 7 years I've been your county executive. We have defeated every one of them, whether it be fiscal, whether it be weather-related, whether it be measles, health-related. We have gotten through every challenge thrown at us, and it wasn't just government doing it. It was all of you. If it wasn't for your belief and your engagement and involvement in being part of this government and part of this county and part of our community, we wouldn't have had that success. So again, let's not forget that. Let's believe in ourselves. Let's believe in the strength that we bring to the table. And again, I know this in my heart. Together, we want to get through this. Normalcy will return, and our lives are going to be fine. And with that, I'm going to sign off now. Have a wonderful afternoon. This is your County Executive Ed Day. Wishing you the very best.